Hey, what's up, everybody? Thanks for tuning in. So today I want to cover a recent injury that happened in the NFL. Unfortunately, a player, the Bills safety, Damar Hamlin, went down on the field with what's suspected as a cardiac arrest. He laid motionless on the field for numerous minutes before he was taken into an ambulance and taken to a nearby hospital. As it stands at the time of recording this video, he's still in the hospital in critical condition. So I want to talk about what may have potentially happened. It's a sensitive subject, but being someone in the medical field, I'd actually like to give some medical kind of opinion on the subject rather than just throwing around random things. So hopefully this video is educational. Just understand that it's speculative. I don't have all the information, and I don't think I should have all the information now. It's a very private matter, but I want to at least talk about what I think is going on, so that way we start to dispel some of the rumors that may be floating around. So the diagnosis that may be associated with what's going on is something called Commotio Cordis. So that's the name. Let's take a step back and talk about what happened and why I think Commotio Cordis is what happened to Damar Hamlin. So he's on the field, he's assisting in a tackle, and all we know is what we can see. So he took a shoulder to the chest. At the time he stood up, looked a bit disoriented, fell down, and we know the rest. So what likely happened is that shoulder to the chest, that blunt force trauma that he took, caused Commotio Cordis. So what is Commotio Cordis? Commotio Cordis is what happens when there's an interruption of the electrical signal supplying the heart, which results in cardiac arrest. So let's quickly define cardiac arrest, because it's important to understand that. Cardiac arrest is what happens when the electrical signal that powers the heart, causes each heartbeat, ceases to exist, which is a bit different than a heart attack. A heart attack is what happens when, the medical term is actually myocardial infarction, but it's what happens when part of the heart muscles stop receiving blood flow, which is why you might hear that individuals have had a heart attack over a series of hours or even days, because there are other parts of the heart that are still receiving the blood flow. So the cardiac arrest is definitely much more of a medical emergency because there is no heart rhythm. And this is important because the heart, it supplies blood to all the body. Blood carries oxygen. Oxygen provides the necessary nutrients for most things in the body to survive. So what happened was, again, that Commotio Cordis, I think, is most likely what happened. And it's most often seen in younger athletes, usually between 12 and 18 years old. That population might be skewed just because younger kids are who play sports, and they're more likely to receive a blunt force trauma to the chest than someone just walking around. But regardless, it's most commonly seen in pitchers that take a line drive off the chest, and it happens at a very specific part in the heart rate. So, the heart rhythm, the heartbeat. So it's not that every time you get hit in the chest, this is going to happen. It's a very specific timing. So if we look at the electrical impulse that powers the heart, we define that as a PQRST wave. And every time the heart beats, it goes through this PQRST wave. If it doesn't, there's some other issue going on, but by and large, in a healthy heart, it's the PQRST. With Commotio Cordis, the impact usually happens right about the beginning of the T wave. And this is a very, very, very finite time. And so, again, every heartbeat happens in that PQRST wave. Now, if you have a faster heart rate, that means that window of time for you to hit the beginning of the T wave is even harder to hit. So odds-wise, it's very, very difficult and unlikely that this is to happen anyways, which, thank goodness, this seems to be the first time we've seen this in the NFL. So what happened after that was the medical staff thankfully immediately recognized something was going on, went out and provided chest compressions, and they provided an AED, an automatic external defibrillator. So they loaded them up into an ambulance and then they left. So it's a big hats off to them, hats off to the medical professionals, the athletic trainers and the doctors there that provided what was essential at the time to help with survival. So this is a good lesson for if anybody is involved or has kids involved with youth sports. Youth sports is, again, that age range 12 to 18. An AED is pretty necessary to have on a field. So This isn't something that's exactly known by everybody, but CPR in isolation is not very successful. So when there's the heart has stopped and the electrical signals have stopped getting to the heart, we're using a manual compression to try to restart an electrical signal. Now the numbers are variable, but it's as low as a 7% success rate with CPR alone when there's a cardiac arrest. The numbers jump up to about 40% once an AED is also used. So the AED is going to shock the heart back to the rhythm that it needs to have. And the AEDs they're pretty good. They explain, they tell you compressions, they tell you to continue CPR, but it's pretty necessary to have these. If we're going to have an increased survival rate of upwards of 30%, it's definitely worthwhile to have. So if we could take anything out of this, appropriate medical care is essential when it comes to treating things like this. So at present, Damar is still in the hospital in critical condition, but things definitely could have been much worse, and the appropriate individuals responded in ways that they should have. So if anything we could take out of this is, having an appropriate emergency action protocol. So if people were to go down, and if you are involved in youth sports, having the right personnel, knowing what each individual needs to do in terms of grabbing an AED, performing CPR, is essential for helping future individuals that might go through this. So I hope you enjoyed. I hope you learned a little bit of something. If you have any questions, feel free to drop them in the comments. If you have any more topics you'd like me to cover, I'm happy to do so. Thanks, everybody.